year. But for one North East charity, it's thought of nothing else for the past 120 years. How it's gone about it has moved with the times. But I've uncovered some remarkable archive of the charity's early days and brought together different generations of people whose lives it has touched. Leon and Simon grew up in a difficult family environment. Walter and Irene hadn't taken them on, they'd been in care.
Sorry. Well, we'll say sorry to Simon first then. Right, thank you very much. If you'd come here 12 months ago, he would be just everywhere all over the place. Really violently jumping all around randomly.
Changing their behaviour is no easy task, but Bernadette is on hand.
Obviously remembering to be really clear with what you're expecting him to do or not do.
She's the modern face of a charity that since Victorian days has tried to give kids a better chance in life. In its 120 years, child poverty hasn't gone away. It's just less obvious.
We don't know how many children go without food, go without meals. We don't know how many children are wearing long-sized shoes. A third of children in the North East are in poverty, but you don't see it.
It's also different to the charity's beginnings on the banks of the Tyne, where children lived and worked in squalor.
There were a lot of slum housing, there were some heavy industries like whale blubber factories, pipe shops, chemical manure works, so it would have stunk.
And so a shelter was set up to get the children off the filthy streets. They were tempted in with magic lantern shows, but what they really needed was fresh air. And so began the Poor Children's Holiday Association. Over the years, thousands of kids were taken to the seaside. They could fill their lungs, their bellies, and just enjoy themselves. But the charity's founding fathers noticed many had tuberculosis, a potential killer. Something much more ambitious was called for. In a revolutionary move for its day, they set up a specialist care centre for children with TB. We've unearthed this remarkable footage of a sanatorium where children were treated on an industrial scale. It was tucked away in the Northumberland countryside, which meant for the young patients, mums and dads soon became a distant memory.
This said I would have to go to Stannington for 6 months. They were just pushed into the van, everybody indoors shutting off the wind, that was it. And it was weeks and weeks till we saw our parents again.
I was lost, I didn't know where I was. Coming from the fishing side, we gone into an area where there wasn't a fishing boat sight ever seen, getting out of a little bus, and I was looking at the boat, I didn't know where I was. I was completely lost.
The nurses appeared as prim and proper as their uniforms, but underneath they couldn't help but take a shine to their patients.
They were so cute, and you definitely did have your favourite. You took the ones to your heart, like.
But with care came discipline, and woe betide those who broke the rules.
Once you had your lunch, you used to go to bed and have 2 hours sleep. And I was talking quite a lot to the other children. And the nurse, I could hear her coming along the corridor. So when she got away, I would start again. The next thing I knew, I was hoisted up in the bed, and a scarf wrapped around my mouth and tied to the bed rails, and I was gagged. I never said anything after that. I was quiet.
Brian was the middle of 3 brothers. All were admitted to Stannington. The eldest had spinal problems and was strapped to his bed for 2 years.
The nurses told me that I hadn't to get up and I hadn't to move around, and I was strapped down, I had to interfere with the straps, and that was it. It was a simple job. Because one day another came in the wall, and she had to ask the nurse, which was her son. I shouldn't have seen me up for such a long time.
It was state of the art. Some treatments now appear rather brutal, others quirky. But this rediscovered footage is fascinating to today's medics, who now have drugs to fight TB.
Artificial weight treatment? No, that's a new one on me. Oh, I haven't heard about that one. Many of these children, especially in the North East, would not have had a huge amount of exposure to sunlight. They would have had vitamin D deficiency, they would have had rickets, so that would have predisposed them and made their tuberculosis worse.
The sanatorium is no more. As TB cases fell, the charity moved on. It's adopted a 21st century name and now tackles modern issues.
Hi and welcome to Waves. Come and have a look at the project. young people can drop in to see us on a range of issues, specifically general health, mental health and sexual health. They're scared of going to see a professional for the first time, like going to see their GP or their practice nurse, and they already have relationships built up with us as their youth workers, and they like us to support them and giving them advice and actually coming in to see the nurse as well.
The charity is also working in schools. It helps children who may struggle to attend conventional lessons learn about health issues and, importantly, gain a qualification.
Think about what stresses people out.
Having no money.
Having no money, yeah.
And friends say something that was not true.
Yeah, that's a good one. Because it can happen quite a bit, and then that can then lead into bullying as well, can't it?
Education was also on the timetable back at the sanatorium, but only 2 hours a day. Fresh air and exercise were more of a priority, within reason.
They did not like you running about. You couldn't play football. That was one thing I used to miss, you know, because I used to like to play football.
And they also missed the nurses, who sometimes left the sanatorium before the patients.
No, I said, but we didn't want you to go, Bobby, right? You're still going to stay, Bobby, right? Come on, come on.
Staff and patients alike were well fed. Good food was an essential part of the regime, and for the patients, it had a lasting effect.
We all agreed that it wasn't very nice of porridge. It used to be a lumpy affair.
Or for me to pass out my hickle with. I just passing it. Oh.
Although they grew up in different centuries, healthy eating remains a core belief, and 2 months of intense tuition by the charity has brought about subtle changes.
Intentions are pretty given up. They would have been high-fi foods. Things like tuna sandwiches and everything else. I've got more confidence in that, in myself, and I can do more. It's been interesting. I've learned a lot. How to make a good, healthy run. And I've learned stuff about STDs and health.
As they look to the future, Brian and Ray are looking back at their medical records.
2 brothers in sanatorium, age 5 and 11 months, probably in tuberculosis. The thing is, I've got a tear in my eye, actually. I'm really emotional about it, really. It seems to be pulling things out of my brain that I had forgot about. And I never thought I would remember it again.
It's time to bring the generations together for a special viewing of the old film, a time long before the NHS.
Gosh, it is an old-fashioned nurse, isn't it? Gosh, you got... Oh, look at that. An injection. I never got an X-ray. Just put your chest up against the thing. Put your shoulders forward, and your head on yourself.
The youngsters were intrigued to know more. How did so many children manage to get along?
Oh, yes. I can't remember them now, but I was only 5 at the time. The only thing is I can't remember seeing girls. No. I kept them separate. They were a different water.
And before free healthcare, who picked up the tab?
Did you have to pay money to pay money for like going to treatment and all that?
It was subsidised by the Northumberland County Council.
Different generations who've been given a bit of extra care by the same charity. Times have changed, but over the last 120 years, one thing hasn't altered. The knowledge that to tackle deprivation, you have to look after the next generation.